A day in the life, that was something that we devised because we wanted to get people thinking about their normal day and the different types of activities that make up your day. And what we do, we ask the carers on the course to list all the activities that they did yesterday. And then in the second part of the task, we ask them to list all the things that, just to think of one resident and to think of all the activities that they did yesterday. And it's really to get them thinking about the different types of activities.
That task was a task that we did in our occupational therapy training. And it's really to get people thinking about the sort of things people would usually do in a day. And then we get them to look at the things that one of their residents might have done in a day so they can see the difference. It enables us to then discuss things like all the different roles that people have in their lives and how that makes their life meaningful and how it helps people to feel valued.
We get them thinking about how different activities are associated with our different roles. So your role as a parent, as an employee, as a friend. And then we get them to think about, in contrast to that, the residents, what activities do they have? And often, most of it is left blank. Well, they were got up, they couldn't get up themselves, so they were got up and dressed, had breakfast, and then there's a big gap until lunchtime. They were given lunch, probably something in the afternoon like they were put in the lounge with the telly on, and then they were given the food, evening meal, and put to bed. And so we asked them, well, how many of those activities were things that they chose to do and how many were things that they had to do? So, you know, eating and drinking is something that is just a self-care task. It's necessary. It's something that everybody does, part of your daily routine. Getting washed and dressed, the same. These are activities that often the residents are not able to do independently, so they're reliant on someone to do the activities for them. It's something that's done to them. And so their roles during the day, basically they're just receiving care. They're just somebody who's ill, you know, dependent. And it's to get them thinking about that person, and that person had a life before they came into the care home. They had a job, they had a family, they might have been a husband, a wife, they might have been in the war, you know, and all the different activities that used to make up their day and all the different roles they had, and now how that, when they're all taken away from you, activities are what make us as people, aren't they? They're what define us, and it's to get them thinking like that.
When they lose the ability to do that, apart from losing everything like your home, you lose your autonomy as well. And you come into a care home, it doesn't matter how good that care home is, you're still in somebody else's routine, you're having things done for you that you might have done yourself before. You're no longer able to do things for other people where you might have done that before. So it's to try and get them to think about the change to someone's life and how that might impact on how they feel about themselves, and why therefore it's important, it's really important for the staff supporting those people to be trying to think of how they can engage the person more, you know, by understanding their history and what their interests are and what they used to do and things like that.